And certainly last but not least, our leader, our health officer, Dr. Donald Shell.
Well, good morning again, everyone, and thank you for coming for a wonderful day. And I am just honored to be able to be here to have a role in the renovations that you've heard and so many things that Dr. Hughes has reviewed. Some of you have folders with you, and I wanted to direct your attention a moment to the folders, and then I'll make a few comments. Within your folder are some sheets which reveal healthcare services for women. There's a sheet that has a general guide to health department services and resources. And so you have a guide for general health department services that is alphabetically listed, so you may be able to see where individuals that live here in the county can access and receive services, or where you may refer them to. The health services for women is a two-sided document. We also have a guide for children, which is not included. But the reason I bring that up is that the health department is an agency that focuses on the health and well-being of all 870,000 some odd residents in Prince George's County. And we interface with them in many different ways. And we know that there are significant challenges or disparities in health care for residents in Prince George's County, and we know for the National Capital Region and for Baltimore City. And there are certain pockets that are predominantly minority pockets where health outcomes are not the same as the general population. In order to address those, we have to have focused programs that deliver services that are going to have a meaningful impact. One of those are the dental services that we are here to celebrate, and you're going to take a tour of a wonderful facility. Even though we understand that there are gaps in services, but the head knowledge or the recognition that the gaps are there are enough to get you started to think about it, but that has to be followed by some type of action that results in tangible services to be delivered. We have the partnerships that are here, and I also want to recognize all of our other practicing dentists that are here. I know Dr. Clark is here. Do we have any other practicing dentists that are here in the community? Thank you very much, all of you, for coming, and let's just recognize them for being here today. And the reason I say that is because, dental care, I'm not a dentist, I'm a physician, I'm a family practice doc, and in order to practice your trade, as a family practice doc, I pretty much had a stethoscope, ophthalmoscope, blood pressure cuff, and I can roll. I can work. As a dentist, you need so many supply, equipment, autoclave, sterilization. There's a lot of equipment that goes into delivering dental care. Now, I never had an x-ray of my teeth until I was 15, 16 years old. So some of you say, well, back in the 20s, they didn't have x-ray equipment. But I wasn't 15 or 16 in the 20s. I was 15 or 16 in 1976. And so you would imagine, say, well, what happens to a young man that doesn't get his first dental x-rays until he's 16 years old? You can imagine. I loved my dentist when I was growing up because he never did anything to hurt me. He looked in my mouth. He asked me questions while he had two hands in my mouth, and I just said, I answered the question, and it was a wonderful relationship we had. Unfortunately, my dentist died suddenly at a young age, and my mother and father had to find another dentist for me at the age of 16. So I go see this new dentist, and he says, okay, we're going to take some x-rays of your mouth. And I said, x-rays? It's like, what are you going to take x-rays for? All you have to do is look at my mouth, and you'll be able to tell that everything is okay, like it's always been in my life. Well, lo and behold, what do you think the dentist found in a 16-year-old male's mouth that had never had an x-ray? How many cavities do you think he found? I had so many fillings in my mouth, I used to receive radio transmissions. I'm still having those fillings replaced. I had so much silver in my mouth that I'd walk by. I didn't even need a Bluetooth to receive telephone signals. I ended up having about 25 cavities. I didn't even know how many teeth I had in my mouth at that time. Almost all of them had cavities in them because I'd never had an x-ray. And my parents had health insurance. I had access to a dentist, but he just, God bless his soul, he was a great guy. I loved him to death, but he, So I went through the procedure of 6 or 7 months it took me to get all those cavities filled. But that is for a child, and we talk about the importance of children because most of the resources that are available for dental services are for children for pregnant women or other specific populations. But there's a huge population of adults that we still have to work from a national perspective, a state perspective, to find the resources so that when we tell a child that you have to value your teeth and to receive ongoing periodic dental services. When that child is born and we say that the child's mouth needs to be examined before they're 1 year of age, it would be nice for the parents also to be able to get access to care, because asking the children to do something for the parents to do something for their children that they can't do for themselves is a mixed message. And so with all of the strides that we have made and all of our accomplishments, we still have a lot to do from a federal perspective, which will trickle to the state and to the local government. A few years ago, we were fortunate enough to have our federal legislatures, and none of them are here today, but I want to recognize our federal senators, our federal congressmen and women, because without their support, the resources to renovate this facility and to renovate our dental suites and the 4 school-based wellness centers would not have been possible. The other thing that you have in your paper is a press release, and that press release gives you the details for where the resources came for this. The wonderful collaboration the health department has always had with the county executive's office is the ability to have dental health placed on an agenda that is high for the highest elected official within the county. It was high for the county, high for the state, and then our federal partners then agreed, and making a presentation to the delegation in Annapolis a couple of years ago resulted in our federal delegation understanding and agreeing with us on the importance of having a state-of-the-art dental facility in places where we provide services to children and pregnant women and some of our other special populations. It took a couple of years to happen, but that resulted in this $471,000 of resources, hard resources, to be able to bring our clinics in the health department up to standard with those in the best practices in the private sector. And as I stated before, we can understand that significant gaps are in existence, but that then has to translate into individuals with the ability to dedicate resources to make those resources available, to provide the tools that are required and the resources to pay those individuals who are going to provide that care to occur. And with the recognition, with the resources, and then with the focused effort, we're able to do the significant and wonderful things that our dental program and Dr. Hughes has been able to accomplish with all of our partners that are up here sitting with us. The last thing I'll say is that we did talk a lot about education. I want to share with you a few statistics and numbers that I've seen. If I didn't share some numbers with you, I'd be remiss, because I'm primarily a health educator as a family practice doc. But just so you can think about the significance of the comments you've heard about dental care. If a woman has moderate to severe periodontal disease, which is inflammation in her gums or in her teeth, she's 4.5 times more likely to deliver spontaneously before 37 weeks gestation. 4.5 times more likely to have a preterm birth if the woman who's pregnant has untreated dental disease. She is 5.3 times more likely to deliver before 35 weeks gestation and 7 times more likely to deliver before 32 weeks of gestation. In addition, there have been other studies that have reported that it was 17 studies that looked at 7,000 women. And that study suggested that preterm birth was 3 times more common in women with periodontal disease. And so the studies don't all agree exactly on the impact, but it's significant. 3 times more likely to deliver preterm birth, other studies saying 7 times more likely to have a preterm delivery. Prince George's County, you may or may not know, leads the state with the number of women who experience poor birth outcomes. And so there is a connection between the health of the mouth of the women in the county that have the highest number of preterm births and the highest number of infant deaths that occur in the state of Maryland. And so the efforts that we make for dental care is important for the health of the mouth of the women and children, but it's also important for the health of the rest of the bodies of those individuals. Dean Rouse mentioned the correlation between good oral health and the ability to focus in class. If you can't eat because your mouth is hurting and you can't eat breakfast before you go to school, then you will not be able to concentrate on what the teacher is telling you. The last thing I'll say, and I said that before, but this really will be the last time, the last thing. A lot of the research that talks about the role of oral health in the rest of the body is because of it's believed that the inflammation in the mouth from untreated disease, and I'm going on uncharted waters things, I have so many dentists in the room, I gotta be careful that I don't say anything wrong. If there's no dentist in the room, I can say whatever I want to say, but with dentists in the room, I gotta be careful and make sure I'm saying stuff right. So you guys correct me, all of the residents and the dental students, correct me if I'm wrong. But what I understand is the reason why we focus on the relationship between oral disease and general health, that when there's inflammation present in the tissues of the mouth, then you're more likely to get inflammation in other parts of the body. Inflammation in the mouth begets inflammation in other parts of the body. That is also associated with cardiovascular disease, diabetes, and so if you have a member of your family that has diabetes, which they cannot bring under control, one thing their physician needs to take into consideration is the status of the health of their mouth. Because untreated inflammation in the mouth is going to keep the body in an inflamed state, which is not going to allow good glucose regulation for the rest of their body. And so the cardiovascular disease has associations, the dental health has association with diabetes, but all to say that the health of your mouth is important. I met a young man today who said he had an interest in dental health. He lives he's a graduate, and I forget the young man's name. I just met him here, and he said he's interested in public health dentistry. And so we want all of our dental residents and dentists that are here to think about public health and to think about the significant influence and role that you can have on the health and well-being of a population of individuals. We in the health department definitely appreciate the honor that's been given us to even have something to do with the health of our residents and the work that has gone on through the Dental Action Committee for many years and the planning that's gone into place to change our entire system and to make Maryland a model program did begin here, unfortunately, with the death of DeMonte Driver, but I believe that we've been in the forefront of making the strides to make sure that that never happens again. Thank you very much for coming.